Welcome back to the pod, where we explore the future of health and how to feel like yourself again. Today's guest is someone who's redefining what it means to care for moms. Dr. Sarah Pachtman, known online as Healthy Mama Doc, is a double board certified OB-GYN and maternal fetal medicine physician. She's also a mom, an advocate, and a creator making complex pregnancy care more human and accessible. Let's get into it. Dr. Sarah, can you please introduce yourself for those who may not know you?
Hi, and thank you so much for having me today. This is such an awesome opportunity, and I'm really excited to be here and to talk to you. I'm Dr. Sarah Pachtman Shetty. I am a maternal fetal medicine physician. I practice in New York, and I am on Instagram as Healthy Mama Doc, and I provide education and support and awareness to moms and families with high-risk pregnancies.
Love it. Thank you for coming on. So let's take it from the top. What pulled you into maternal fetal medicine in the first place? And what do those words even mean?
That's a great question. So, maternal fetal medicine is a subspecialty of obstetrics and gynecology. So, it's focused on mothers who have pre existing conditions and enter into pregnancy or develop conditions during pregnancy, or fetuses who have conditions or medical issues or structural anomalies during pregnancy. So, it's all about getting moms through healthy pregnancies and getting fetuses to then become babies through healthy pregnancies. We do complex deliveries. We do some complex family planning services. We do anatomy ultrasounds. We do amniocenteses and chorionic villus sampling to get genetic information from pregnancies. We do it all, really at all. I consider myself a primary care doctor for a fetus. So, how did I get into that? Actually, my mother was an obstetrician and gynecologist. She practiced in Phoenix, Arizona in the 80s and 90s. I was actually born during her chief resident year of residency. And I kind of grew up on a labor and delivery unit. I was around nurses and pregnancies and pregnant moms and attended deliveries sitting in the corner and told to be quiet. But I was there since I was very, very young. And I kind of knew that I was going to do that all along. And then when I was a resident in obstetrics and gynecology, I had so many mentors and such a good experience on my antepartum service, which is when pregnant people are admitted to the hospital, not for delivery. And I just loved it and applied for fellowship.
So you've been delivering babies since you were a baby.
Yeah, kind of. At least since I was a toddler, maybe.
At least since you were a toddler, we'll give you that one. And so you grew up in the medical system, then I think that's fair to say. How was navigating that? I have friends who went to Stanford with me and they're in their residency, and gosh, it is such an incredible commitment. And I have so much respect for what you do. But how was that entire process of medical school and residency and practicing?
So medical school is like really fine. You're with your college friends, everyone's doing something. I guess you're not going and getting a job the way that everybody else is, but doesn't seem like so long and so daunting. It's very challenging and competitive to be admitted to. So that's a little bit, I guess you could call it scary or intimidating. Fine. So then you get to medical school, you think everything's great, you're studying, you're memorizing a bunch of stuff. Then you get onto your clinicals and you're like, this is cool, that's cool, everything's so cool. Then you get to residency and it sucks. It just sucks. I'm not going to lie. It kind of takes you aback a little bit. Like you don't know what just hit you. It's about an 80 to 90 hour work week every week for 4 years. We did night shifts when I was a resident, 6 nights a week. We only had Saturday night off. We worked from 6 p.m. to 6 a.m. So it's like you dissociate from the world. But your family with your co-residents, do you kind of love it? I don't know. It's weird. It's a love-hate kind of situation. And you're so immersed in learning and practicing that it just kind of becomes you. I think for me, navigating that was a little bit challenging because I was trying to be a girlfriend and a fiance and do other things and be kind of a normal person, come out of my apartment for 1 day a week. And it's difficult because you're around all your co-resident friends or your physician friends. And everyone's like, you guys, all you talk about is uterus, pregnancy, vagina. And you're like, okay, well, I mean, yeah, we kind of love it. So you have to give yourself some grace and step away from it too a little bit, I think. And then practicing is the same. Like it's really an art form and it's more than just a career. It's like your whole, it becomes a little bit like your identity. So it's navigating that in good ways and bad ways.
And I hear they throw you into the fire, right? My buddy who's studying, he's in residency to be an orthopedic surgeon. He said his first day in residency, he had to set a broken arm. And he said, all of a sudden, I woke up, put on my scrubs, and then I was, moving bones around. And I was just like, is this real life?
He's right, and it's so true. Like my first day of residency, I'm walking up the hill with someone who's now one of my really good friends, who was my attending at the time, and we're going to an ambulatory surgery center. And then we get there and we're doing a procedure, and she's like, "Okay, go." And I'm like, "Me? I'm supposed to
Me?
do this?" Yeah, like, is this safe? Is this real? And the first time you deliver a baby with your own hands, with you're managing the labor and delivering the baby, it's like, did that just really happen? It seems almost surreal. And yes, you're totally thrown into the fire. Like, free, go, good luck, but also be safe and don't hurt anyone.
My goodness. And can you explain the matching process? I imagine there must be anxiety there for doctors. Is that for residency and after residency? When does that take place?
Yeah. So the matching process, I was in a sorority when I was in college. So I was like very, very big into Greek life. And it's very similar to sorority and fraternity match. So what happens is you are a medical student. I, for example, went to University of Kentucky and I was applying for OB-GYN residencies. And there's how many in the country? Maybe 90 or 100. I actually have no idea. I just made that number up. Maybe there's
We'll
90
go
or
with it.
100
We'll go with
MFM
it.
fellowships. Sure. So you go and you say, I'm going to apply to these programs because I know that I want to practice in a state with a lot of people in these specific cities, or I want to be close to family, or for whatever reasons you apply to those programs. Great. Those programs review your application. They interview you. If they offer you an interview, you choose whether or not you want to go based on how many other interviews you get. Then you go interview at all the places. You make a list of your programs ranked from top to last, first to 20th, 10th, however many you choose. And then the programs make a list of their applicants that they want in their program from top to bottom. And then these lists go into this magical vortex of residency matching land, and a third party or a computer or something like that matches you and creates a list of you're going to this place. And then everyone on one day in March gets the letter saying on a Wednesday saying you either matched or you didn't. I think it's Wednesday. It's either Wednesday or Tuesday. You matched or you didn't. And then that Friday, you get to open another letter saying where you matched. So for me, I had never been to New York before my interview for residency. And when I came here, I was like, this place is a little crazy. Like there's a lot of people, first of all. People are a little bit more abrupt and open and maybe forward than I was used to being in Kentucky. I went to medical school at the University of Kentucky. And wow, this is different. But I still liked it and I put it on my list. And then I got my letter and I was like, oh my gosh, like I'm moving farther across the country from my family in 3 months to take a job that here we go. And I don't know anyone there, no one. So great. And so, yeah, you get this letter and you are like contracted and obligated to a between a 3 and 4 or 5 year position where you are paid pennies on per hour. Like I think it works out to be like $6 or $7 an hour, how much residents are paid. And you move there and that's your residency and your home for the next however many years. And it is the same for fellowship.
Wow. That is an insane process.
It's kind of crazy.
I'm going to ask about the least important thing of that first, which is what sorority were you in?
I was a Delta Gamma.
Nice. DG, very strong national sorority. I was a SAE as
Okay,
well.
yeah, you're our brother fraternity in Vanderbilt where I went to.
Love it. And so that's an insane process. So now you're So then you move into New York and then you've stayed. That's where you've been, right?
Yes. I've stayed in my same program, my same institution with my same new family, I call them, since I moved to New York.
Love it. And so since then, now you're practicing medicine and you've done a really great job of building a community online. What's the thesis and the purpose behind Healthy Mama Doc?
So I started Healthy Mama Doc after really, truly a lot of failures prior to that. I always wanted to have a support group for pregnant moms because I would make my rounds in the morning when I'm on my antepartum service. And some of these women are admitted to the hospital with so many unknowns and such scary diagnoses for weeks or months. I know that sounds wild, but it's true. And I was like, you guys don't even really get out of your rooms to hang out with each other, talk to each other. There's like so isolating. And so I wanted to, when I was a resident, start a Facebook group when Facebook used to be cool. And I tried it and it didn't really work. Wasn't really the time for it yet, I think. It didn't really take. And so I kept thinking, how can I get people together to talk about it and support each other? And how can I do this and have a lot of friends online? I keep in touch with my family online. Like this has to be the way, right? So then fast forward, it's COVID and I'm like, okay, I'm sitting home some days where we're doing more telemedicine when I'm not in a COVID ICU. And I made dough bread and it didn't rise. So now what am I going to do? And I started Healthy Mama Doc. And so I'm like, you know what? I'm just going to open up an Instagram page. I know it's for pictures, but I think I can write some captions. And I started posting some stuff. And it kind of blew up because I was a advocate for vaccination in pregnancy, even vaccination in people who are wanted to be pregnant or postpartum or who were thinking about pregnancy, which is a very untapped area for medical data. So I was putting stuff out there. I did a campaign for the New York State Department of Health and went on like the subway and I think the back of a bus or a bus stop or something. And so that's how that started. And it kind of got big from there. And I've just used it as a platform to share information, get insights, and spread knowledge, really.
It's incredible. I mean, over 65% of young adults and particularly women seek health information on social media. And so it makes sense that there should be qualified people like you giving them real advice,
And
right? So,
yeah, and it's hard too because I'm here. I mean, I'm a Western trained physician. I practice
yep.
evidence-based as best I can medicine in a broken system, and it's difficult. And the experience of seeking and providing healthcare in the United States right now is really challenging. And there's like this thing going on right now where people just don't like doctors that much. It's very polarized as much as things are in 2025 vibes or whatever we want to say. So I do get a lot of haters on there and a lot of people who say you don't know what you're talking about, you're indoctrinated by the man and you're getting money from big pharma and whatever else. And I'm like, okay, I'm just trying to share my knowledge and I keep moms and babies healthy and this is how and this is why. And if you want to know about it, I'm here for you. And if you don't, you don't. Sorry.
First of all, if you have haters, that means you're doing something right, in my opinion. So kudos to you. And I think it takes courage to put yourself out there and post, particularly as someone with you with such a traditional background, right? As a doctor. And I think it takes courage. So kudos to you for doing that.
Thank you.
And one thing that I've seen maybe since COVID, and with just all these different media forms and people talking about the medical system, is one common criticism that the medical system gets is that our traditional system treats symptoms rather than the causes. How do you think about that balance?
So it's also the same when people come to me and say, doctors don't know anything about nutrition. And here's my take on that. Am not a nutritionist. I'm not a dietitian. What I know about nutrition, I learned from a few days in medical school, but also what I know about a lot of things I learned from a few days in medical school because there's so much to know about the human body and about pathology and regular physiology and anatomy. One person can't possibly know all of those things. There are other types of physicians who specialize in nutrition, obesity medicine doctors. That's what they do. Fantastic. So when I am like confronted with something of somebody saying, oh, you don't, you have a specific take on it, or you don't know, or you're this and you're classically trained and you don't really understand this whole picture. I'm like, I'm not focused on nutrition because I'm focused on saving lives of people who are already in diabetic ketoacidosis, because that's when they come to me. So let me get them out of that, and then I'll focus on teaching them about a balanced diet. And when people say you're treating the symptoms and not I can't, I can only do the best I can to treat your lifestyle and the lifestyle that our society has created. It's no one's specific fault. It's just that a lot of the underlying root cause of disease that we are facing now is because of the way we live our lives and the environment in which we live our lives. And I can't treat that. So all I can do is, and I can't really change that. And neither can you in a lot of ways. It's kind of like I can't avoid microplastics. I can reduce my exposure, but there are microplastics in the Mariana Trench. So unless I'm like moving to Mars, that's not happening. Right. So I say, no, I'm only doing the best that I can. And unless you're going to exercise every day like you're supposed to, not have a sedentary lifestyle, all of these things, I eat well and healthfully, I'm not going to be able to treat anything but the symptom.
Makes sense. And let's say that you get a new patient. They come in and they're trying to be healthy. Their goal is to have a happy, healthy child. Where do you typically start?
So I love a preconception consult or someone who's TTC or trying to conceive, because that's like such a great opportunity, right? I get the chance to let them, empower them, and enable them to be their best self. And when you're pregnant, your body is literally the temple. It's the house that your fetus and baby are growing in. So I love a chance to sit and talk to someone about dietary changes, lifestyle habits, things that you can do, optimizing your medical health to make yourself have a healthy pregnancy. And it's difficult. Sometimes it takes a whole overhaul. And sometimes it just takes a few small changes and all of the gamut in between. So I don't really know if that answers your question, but
No, I think it does. I think the start is empowering them to take control of their decisions, right?
totally.
Fertility rates are plummeting, right? I know we've all seen that. On the men's side, where I've done a lot of research, and that's where we started our company, sperm counts are halved, down 50%, testosterone's down 30%. This is an impossible question, but why is this happening, in your opinion?
It is the multi-million-dollar question, and I wish I knew. And it's almost the same as like, why are we seeing so many and so many more frequent rare cancers in young people, and cancers that used to be reserved for older generations or older people and more frequent and more common. I mean, we're seeing colorectal cancers at staggering rates. It's wild. And I don't know. And I think it's a combination of exposure to environmental toxins that we haven't really even identified yet. I know things like microplastics and thimerosal and the mercury that's in your flu shot or whatever are things that are being targeted right now. But it's a combination of that. It's lifestyle habits, eating habits, it's exposure to medications. The way that we're living our lives is obviously the only thing that has evolved, because evolution takes much, much more time than it has taken to cause these decrease in fertility rates and sperm counts and increase in cancer rates. But I will say one thing that I'm very proud of, I'm very excited about. For the first time in many, many, many years, the pregnancy rate in women over age 40 exceeds that of teenagers. Yes, I'm very excited because I think that this whole thing of age 35 being elderly, I hate that word, or geriatric gravidas is wild. You're not old when you're 35. I deliver patients into their 40s and 50s all the time. And it is with the health of fertility treatments and options, but it's also because we are decreasing teen pregnancy rates, which is a huge, awesome thing for our society and our culture to have done, when previously, if you were a teenager and you didn't have access to, or it was somehow some bad sentiment or issue around taking birth control, that has kind of gone away. And so we are allowing young women to take their lives and their bodies into their own hands, which is great.
That makes me so happy. I am so happy you're delivering into women's 40s, 50s. That's incredible. And I think it just gives people so much flexibility. And me, as a single 31-year-old male, like, I don't know who my wife is. I love her so much, whoever she is, but
That's so cute. Yeah.
everyone's on their own timeline. And so when I do, get married someday, what should my wife and I do when we are preparing to have a kid? And are they the same for men and women?
So good questions, and not necessarily the same, but a lot of the same things. So decreasing alcohol exposure and decreasing exposure to marijuana and various substances always is a good idea, just because they can be teratogenic. Also, marijuana can have huge effects on sperm counts, as we know, and their motility. Put down your freaking screen and talk to each other and have sex. How about that? Have sex. Wife should take a prenatal vitamin with folic acid starting from when you get married or whenever she might have a chance of being pregnant, because it really only works as a mode to decrease neural tube defects or brain defects in fetuses when it's taken before and in the first few weeks of pregnancy. And you might as well get on it while you can. Healthful eating a whole food, plant-based diet with lots of plant-based proteins, even animal proteins, just as long as you're mixing it up with starches and fibers and things that come from the earth. Do the periphery of the grocery store, or don't eat things that come out of a pouch or a plastic bag, however you want to shake it. Don't smoke cigarettes. Oh my gosh, smoking cigarettes like paralyzes your reproductive tract organ tubes such that they can't move sperm down them. So just avoid that. It's a good plan. And that's kind of it, really. The main ones.
It makes sense. It's so simple yet so hard for
It
some
really
people, right? And so many people want to take a pill and have their problem be solved rather than eat healthy, get sleep, cut alcohol, cut vaping and cigarettes, and eat real foods.
Yeah. Sleep is another big one too that I forgot to mention. Sleep.
Sleep, and have you seen there's been a lot of press recently about metabolic dysfunction, right? How like 9 out of 10 Americans have poor metabolic health linked to like chronic conditions. Have you seen this is the case in your patients? Like, are people getting sicker?
Yes, absolutely. People are getting sicker. They're getting diabetes younger. They're getting more and more obese. And I know there's a huge discussion and controversy around even the diagnosis of obesity. Like, I get it. BMI is a terrible metric, but it's what we have. And that, along with waist circumference and your overall cardiovascular health, it's just really getting worse. And people are exposed to more oxidative stress. They're not sleeping, they're really truly eating chemicals and not eating real foods that come from the ground or come from a tree or come from an animal. And they're compromising themselves. And on a cellular level, our health is getting worse for sure.
Gosh, it's so scary, but so real. And you got to think, if our cells are malfunctioning, it makes sense that literally everything downstream of that would be affected.
Of course.
Turning turning a little bit towards you now, how has motherhood changed the way that you view medicine and show up for patients?
It's been an incredible journey and just a remarkable transformation I've seen in myself. I used to be the type of doctor who was like, oh, I'm sorry if you might be hearing my 3-year-old. He gets really excited when he knows that mama's home. When I used to be the type of doctor who would approach things, we need to get this done, this done, this done, this done. These are the steps for you to have a healthy pregnancy or have a good GYN exam or whatever it was. Ever since having my son, really I'm putting those actions and those things into context more. Not everybody's journey is the same. Not everybody needs really truly the recommended quote course of treatments or tests or actions because it's so individualized, and how people are approaching their personal journeys and their life journeys is really truly the crux of what we're trying to do here. I'm trying to get people healthy, empower them to take control of their health, empower them to understand their health. If you don't want a specific specialized ultrasound test, then don't have it. Understand the risk of what I'm looking for when I'm doing that, but that's okay. Where I used to be like, oh my gosh, this patient doesn't want that. Why? What's wrong? Why wouldn't she want that? Because not everyone's the same. And they're coming from different places and really truly grasping at their experience in a different way. And that's how and why I've really transformed as a doctor and offering my patients things in a different way and with a different approach.
And we've talked about how hectic and crazy the life of a doctor is, right? Going through residency, and there's a lot of pressure and expectations. How do you protect your own wellness while juggling being a doctor, a mom, and trying to help people online?
That's a great question and something that I'm working on. That is my personal journey. I'm not that great at it, to be honest. Like, I really have to remind myself that when I put that I'm going to exercise this day on my calendar and go to the gym, I have to treat that appointment with myself with the same respect and the same urgency and the same commitment that I treat an appointment with my patient for their annual exam or an appointment with anything, and something that is more work related, or my son's doctor's appointment, or mom lunch day at school, or whatever it might be. And I have to really commit myself, and it's really hard because that's kind of the first thing to go, right? You're like, oh, I'm tired, I don't want to, I need sleep, I this, I that, and it's just organizing and getting ahead of my time management is something I'm working on, we'll say, in order to make myself healthy. And I have to remind myself that I can't fill other people's cups if my own cup isn't working on being full.
I feel like it's the classic example where the doctor is spending all their energy taking care of everyone else. And then it's like, wait, what about taking care of me? And I feel like you guys are just under so much pressure to show up for people all the time and be perfect. And then you have to go home and raise your kid, right? Like that sounds
Like,
so difficult.
it's difficult but rewarding. I liken it to this. Like, if you have people ask me, like, what is a day in your clinic like? Like, let's say have a lighter day and I see 22 patients. That's like having 22 meetings in a day. Half of them are first time clients. They all have a list of expectations, questions, things that they need from you. And you have deliverables due by the end of that each appointment or each meeting. And you have to then document, formulate that, and it has to be up to their expectations 22 times in a day. And then you get home and you're like, oh my gosh, I'm sometimes so emotionally exhausted and emotionally taken out that I can't even like really talk. My husband's like, hello, let's go out to dinner. Let's do something. What's happening? Do you want to go on a walk? And I'm like, I just want to sit here in silence. And my 3-year-old wants to crawl all over me, make a lot of noise, play trucks and trains and cars and Paw Patrol and watch TV Mama and eat pizza and run up and down the hallways of our apartment complex. And I'm like, okay, I feel like I can't get a second. But at the end of each day, I look back on it and I'm like, wow, that was actually really cool. And like, you did that and you helped people and you're here for it. And it's awesome. So it's really, truly a journey and a blend of coping.
Definitely a blend of coping, and seems like you
Strategies.
certainly wear a lot of hats. Yeah, and you got to strategize. I would love to drill down a little bit more into maternal health and pregnancy. What's a misunderstood part of maternal health in 2025?
A misunderstood part of maternal health in 2025. Oh, that's a loaded question. But
Yeah. All the
I will,
easy questions here.
yeah, I think when I think about that, there's a lot of spotlight on maternal mortality rates and morbidity rates in the United States because we're a developed nation. We're supposed to be the number one healthcare nation in the world. And our maternal mortality and morbidity, it's really truly a crisis right now. Like our numbers are rising, infant death rates are down, but as compared to 100 years ago, for example. But for the recent years, maternal outcomes are getting worse. So I think what's misunderstood is, at least from an outside of the system perspective, is that is such a multifactorial problem. And it's not something that one side of the system can solve. It's a mix of patients are getting older, they're able to get pregnant and carry pregnancies later, they are getting sicker, they have more complex issues. It used to be if you had terrible diabetes that you didn't control and you had a lot of excess body fat, maybe your body wouldn't ever get pregnant. And now my average patient is on a scale of obesity somewhere. And so it's from a patient perspective and from a society perspective, it's that we're getting older and sicker. And also I think there's a lot of this, well, it's the doctor's fault, or it's it's the healthcare system. It's the system's fault. The healthcare system sucks. So that's one aspect. Another aspect is systemic racism. That plays a huge role. Another aspect is, a lot of times doctors now are operating in a little bit of a silo. I mean, we used to be more well-rounded, I think. Now we're super subspecialized and we only focus on a few things, and communicating with each other is more and more on a computer screen and with a device versus in person. There's a little bit less collaboration than there used to be. This system in which we have to work with delivering healthcare is wrought with barriers and things that huge obstructions. I mean, the insurance system in our country is so distorted. I don't even have another word for it. It's so wrong and so difficult to work in. Like I can't even see some patients because my office isn't on par with that insurance. Like, what does that even mean? I went into medicine to be able to deliver moms healthy pregnancies. That's it. And I have like limitations on that because of something that some person in a suit somewhere probably made up. There's so much administration stuff going on. It's just a difficult system to work in. So it's multifactorial. And I think that pinning it on one side of the equation really is the most misunderstood part of the problem.
I completely agree. It's an oversimplification to just say the hospital system is the problem, or just doctors themselves, which so many people say is the problem. And I think everyone who hates on or talks negatively about our medical system in particular, I think should go and walk into an ICU. My uncle tragically was in critical care, and it was the first time I'd ever been into an ICU, and I walked through, and it was incredibly sad. And it was also just incredible when you walk through, and the amount of things that we're able to do in our system to keep people alive. Like, he was on dialysis, he had something keeping his heart going, he was being fed through a tube. And I'm just like, how is this even possible? I don't really know where I'm going with this, but it's just, it
No,
gets so much flack.
yeah, and I understand you. And I think that the way Western medicine has gone is more towards treating sick people. And so, yes, we are encountering patients once they're sick. You don't see a high risk pregnancy doctor because you're having a healthy, happy pregnancy and delivering in a barn and at your house. I mean, it's just not happening. You don't want me as your doctor. When you have to see me, something's wrong, really wrong. And that's really, truly what people think of as our health system these days. They're like, oh, why aren't doctors doing preventive care? Well, we're doing the best we can, but also you don't make it to us until you're like there already.
Right.
So that ship has sailed. Like, you're not seeing me until something's really bad. And honestly, like, that's my focus. And it's not really fair to say, the health system sucks and the hospital sucks and this sucks and that sucks when we're just doing something different. Like, we're not the wellness industry. I am not peddling vitamins or telling you which version of folic acid to take, because that's not what I'm here for. I'm here to do something different than that. And those things are important too, but that's not what medicine is today. And I think that is also very misunderstood.
And so when women do come to you with medically complex or high risk pregnancies, how do you guide them through it?
One step at a time. It's really like a team job. What are your goals? These are my goals. These are the options. Here are the things that we can do. Here's the things I can't do, because there's a lot that we don't know and a lot that we can't offer. Like, people want me to make sure that their child is never going to have autism. That's impossible. It's just impossible. So I can lay things on the table and talk to you about it, and one step at a time go through the options with you and guide you through it and help you make the best decision for you and your family. And that's what I really aim to do, is one step at a time, cross each bridge as we get there, and hope for the best.
Transition topic I'm interested in, and a lot of my friends have been going through, is egg freezing. And so egg freezing is skyrocketing. It's growing like 20% a year. More and more people are freezing their eggs. The average age at a time of freezing is 37 years old. The live birth rate is 70% if you freeze before 38. Only 12% of women who freeze their eggs use them, and it's expensive, right? Most insurance plans don't cover it. It's like 20 grand a cycle. What are your thoughts on egg freezing generally, and how do you talk to patients about that?
So I also have a little bit of a twisted bias perspective, because my son was born after 3 rounds or 3 cycles of IVF and a few failed transfers, because I waited till I was 36 or 37 to start the process. And it's just a function of biology. When we were primitive humans, we were running around in wherever we were with bows and arrows and eating whatever we could grow and whatever fish we could catch. And we were all dead by the time we were 30 because we were killed by a bear or had an infectious disease or whatever. So prime reproductive years are from when you get your period, from menarche to, I mean, the average age of menopause is 51 years, but I think that that's just like a function of how long we could do it. It doesn't mean how long we should do it. And it's kind of, when somebody was 36 or 37, when we were evolving, they weren't having babies anymore. And so it's not forced per se, allow or enabling it and empowering people to do it. And that's great. And I'm all for it. But people have to understand that when you're 36 or 37 as a female, you're the number of eggs that you have is so much less than when you were born or when you entered puberty. It's like exponentially less. So my take on egg freezing is do it while you can. It's an investment, and probably more than 12% of people would be using them if they had high quality eggs because they got them when they were 25. So do it as a preparation to hopefully never need it, but have it if it's there. I wish I would have frozen my eggs when I was 22 years old, because it wasn't that bad. You take shots for 2 weeks, you go to sleep, you wake up, it's over. It's a little crampy and uncomfortable. Some people have much worse experiences than me, so I'll allow for that. But then you don't have that time pressure, and you don't have to say, oh, well, this technology doesn't work. I mean, the technology is limited by what it's working with. So I'm all about freezing eggs and allowing people the opportunity to have a pregnancy later in their life, but just do it earlier so it works for you.
100% agree. I'm actually trying to go through the process of freezing my sperm right now.
Do it. Put them in a
Yeah.
fridge, freezer.
Yeah.
Why not?
100%. Okay, so moving on to something fun now, Dr. Sarah, we're going to go to the speed round. I'm going to ask you a short question, and then you're going to answer with a short phrase or one word.
Okay. Got it.
Perfect. They'll start easy and then they'll get more interesting. So,
Oh gosh. Okay.
favorite pregnancy food?
Avocado.
Nice. Omega 3s. I love
Yes.
it.
Big time. Great for gestational diabetes also.
Hardest class in medical school?
Gosh. Probably histology. It was just difficult for me.
It just sounds hard.
Yeah, it's a lot of microscopes. It was just hard.
Health trend that needs to die?
Taking too many supplements. It's enough already. Just eat real food.
Expensive.
Yeah,
Just
eat
eat
real
real
food.
food. Most rewarding part of your job?
Delivering a baby to a family who has experienced pregnancy loss. Handing a mom a live screaming child that she's gone through adversity to get.
Beautiful. Favorite workout for you?
Pilates.
Easy. Go to New York restaurant?
Oh gosh, there's so many and it changes like every month. I want to go to the new Daniel restaurant. I love that restaurant that's in Columbus Circle right now. It's like, it was cool a year or two ago. It's like a tapas place. I can't recall the name.
I'm sure the chat will answer it.
I also love, my favorite restaurant in all of New York is Kraft.
Ooh, I've never
I
been.
love. It's fabulous. It's a Tonkalikyo. It's so good. Fresh, delicious food. I love it.
Next time I'm there, I'm going. I'm gonna
That's a
text
must
you.
visit.
Yeah. What's the best New York neighborhood?
Ooh, that's rough. I like the West Village. I like Chelsea. I like Soho for the funky shopping.
What's one thing every new mom needs?
A village, a support village.
What scares first time moms the most?
The unknown of delivering, and just it's a new experience, a new process. It's scary.
What's the most annoying question that you typically get about pregnancy?
Can I take this cold medicine or this specific Tylenol? And the reason it annoys me is because you're a person too. Obviously, yes, it's not all about the baby. Everyone's like, I'll do anything to keep this baby healthy, even if I suffer. I'm like, you're a person too, and you matter too.
Do you have a favorite podcast?
I don't.
It's good. That means
Your
you can start your own
podcast.
podcast. Well, you can start your own now.
Podcast.
This one. That's the answer I was fishing for. What's one word to describe OB residency?
Rigorous.
One word to describe motherhood?
Oh, beautiful. Is there a word that means beautiful and challenging all in one?
Beautifully challenging. We'll hyphenate it.
Beautifully challenging.
What's one thing you'd change about the medical system? I know this is probably not a one-word answer.
Accessibility.
Advice to your medical school self.
It's gonna be okay.
What keeps you grounded?
With my husband.
Final question. What's next for Dr. Sarah Pachtman?
Oh man, that's a good one. I have a lot of things in the pipeline and a lot of things that I'm working on and things that I'm hopeful for the future for myself and my patients. I don't know if I can give them away. I wouldn't want it to share my secrets, but I'm working on some counseling and coaching and empowerment opportunities for moms.
We'll definitely be on the lookout for that. And when you do launch, we will definitely promote them on LifeSpark as well.
Awesome.
Dr. Sarah, thank you so much for coming on. For everyone listening, where can they find you?
I am on Instagram at Healthy Mama Doc. I'm on TikTok at Healthy Mama Doc, and I practice maternal fetal medicine in New Hyde Park and Great Neck, New York. And I do a lot of telehealth also. So I work with a company called UMA. They're fantastic and amazing, and I'm learning a lot of the telemedicine world.
Amazing. Dr. Sarah, thank you so much for your time. We appreciate it.
Thank you so much for having me.